I don't think that's supposed to happen. That is a varicose vein that popped. That needed to stop bleeding. Okay, gotta do something now.
The man behind that home video and exploding vein, Luke, is in our audience along with board-certified vascular surgeon and founder of the Vein and Vascular Institute, Dr. Charles Dietzek.
Luke, I don't know what was more engaging.
That's what we call a squirter.
Was it the squirting that got me, or the calmness about how you just handled it? Like, oh my goodness.
That was the second time it happened.
Second time.
It happened a couple days before that, and it was actually 3 times worse.
Wow.
I actually happened to have my phone in the bathroom with me at that time, and I was like, okay, this would be make a great video so I can show the doctor exactly what happened.
Yeah.
Well, and that's actually smart in that sense. Luckily, you also then knew the minute you put the phone down to apply direct pressure, right?
Yes.
So you knew what you had to do to stop the bleeding so you wouldn't bleed out.
So, Doc, can you comment a little bit on how often this happens? Because as a woman, I know at some point I'll probably get some varicosities of some sort, you know, because as we get a little older or as we get pregnant, it increases our risk of developing these basic veins. So talk a little bit about how often does this happen, that someone shows up with blood squirting out of their leg?
From a varicose vein in this case, since we never really, okay.
Right. There's about 25 million people that have venous insufficiency and some severity of venous insufficiency. Luke had a more advanced case, and there are different things that you can see as the disease progresses. This is just one of them. You could see discoloration of the skin, hardness of the skin. You can see ulceration, large ulcers that are quite dramatic. And sometimes these ulcers won't heal for months, but it's all because of venous insufficiency. Luke had the situation of a ruptured varicose vein, and this time of the year where the weather's a little bit drier, skin tends to crack a little bit easier, you see more of these.
So for most people, that venous blood, you walk around, it goes back up to your heart and gets pumped back through. But in venous insufficiency, it's pooling in the legs. There's a lot of pressure down there. So what do you do in a case like this where Luke's had numerous instances where these varicose veins are literally exploding and bleeding? How do you fix that?
First thing is you have to evaluate him and see what exactly is the reason why he has this. And so the first step is to get an ultrasound. An ultrasound study is going to allow us to evaluate the entire venous system and determine whether there's valvular insufficiency. There are valves inside the veins that are supposed to be unidirectional, allow the blood to go back towards the heart. And what Luke had was valves that were not working in a particular vein. Subsequently, when he would stand, the pressure would go down the vein, and then it would go into branches. And over time, these branches got larger and larger to the point that the skin overlying them was very thin. Subsequently, one ruptured, resulting in that dramatic video.